Good afternoon, everybody. First of all, thank you, LifeCell, and thank you, everybody, for being here. And thank you for that beautiful, warm, lovely introduction. I think after 30 years, it's really a pleasure to be here. And today, what I saw is really revolutionary. I think after 30 years of being in practice and treating infertile couples, uh, it is what I dreamed about 30 years ago. I think infertility is not only just a disease, it's a social problem also. People don't come forward. People initially when I began practice 30 years ago, I had all patients who were coming at the age of 40, married for 20 years, and would come to me after 20 years saying that we want a child. And in those days, it was so difficult giving them a child because IVF success rates with your own eggs was so difficult in those days. The success rates were like 15%. Today, yes, I can confidently say that the success rates are between 40, 50, even 60%. The technology has advanced so much. And to see today's technology where you can test at home, I think it's wonderful. Yesterday, one of my patients, you won't believe it. Yesterday, one of my patients came and she's written me a long letter today. Doc, I came to your clinic. I wanted to see you alone, and you were sitting with three assistants, and I didn't get the privacy that I wanted. And it just struck home that people don't want to talk in front of people. And I think what we are watching today is really revolutionary. I think it's very important. Privacy has become important, and people hesitate in front of, even doctors. And they were all doctors with me, all doctors sitting with me. Not one person was a non doctor. So I think it's really important, and this particular thing, doing it in the privacy of your house, doing it probably even without the doctor's knowledge. Sometimes you just want to know. And actually, this was the patient who just wanted to know whether uh, whatever her things were happening were right or wrong. And she said, I just want to meet you, talk to you privately. And I actually advised her test. And I was just thinking about her as I was sitting that I should send her this home kit so that she can, do these things at home and figure it out and then maybe have a video call. I told her, I said, next visit will be a video consultation. So I think it's so important. I'm really happy to be here. I am a techno savvy girl, I call myself, but techno savvy woman. And I think technology, I'm already using precision medicine in my practice, and I was so happy to hear that. That your next launch is going to be precision medicine. We are using precision medicine. What he was talking about genomics, in using the right medicine for the right person. Uh, there's a lot of it going on. In cancers, it is established, but it's coming in other parts of medicine. He was talking about diabetes and other blood pressure and other chronic diseases, but it's also there in infertility, and we are using it. It's not evidence based yet, but pioneers like a few people like me are using it in our practice, and we are finding fabulous results. So I'm really happy that LifeCell and Mayur has taken this visionary attitude. I call it visionary attitude of going a step forward and making it available, especially in India, because all this becomes available first abroad, but private players bring it to the country, and that is what we've been also been doing. But I think it's very important, and also bringing it at a good rate. I think that's also very important, because only 1 to 2% of our people can afford it, but we have to bring it down to a different level so that everybody can get it. And I think that is what we need to do, and I'm sure you'll do it, because I've seen all your other work where all your other thing, there are different schemes which are available, and we are able to help a lot of people with the cord blood banking. So your work in the other things gives me a lot of, trust and faith in you. And this is a fantastic thing. And two things which I always think about when this test is there. There are patients who come to me, and, when I tell them you need to do, analyze, go for semen analysis or go for blood tests, they don't want to go. They prefer a home collection. So if they can do it themselves, I think that's fantastic. And everybody doesn't need the whole, the whole gamut of tests. So they just need to check their fertility. And the second group of patients is who's sitting at home and who want to check but don't want to go to a doctor. I think these are the two groups of patients who will immensely benefit from this, where fertility is concerned. And perimenopause. I think it's a, women, we have to be aware of women. Women are spending 1/3 of their life in menopause. Our mothers lived with all the problems, but we don't have to live with those problems. We want quality of life. Our life begins after 40. We become more confident. We become financially independent. We learn to live our lives. We learn to enjoy our lives after 40. So we need to know that the problems that we are facing, are they really menopause? Are they really related to other problems, maybe like, thyroid problems? So I think this home kit to test for menopause, perimenopause, is fantastic, because women are confused. All the symptoms that they're facing, and they are scared. You won't believe it, but a very, very educated girl woman I know, in an older woman, allowed a cancer to grow to last stage because she was just too, I don't know, she didn't go to the doctor. So women don't come forward with their problems. So I think this kind of a home test kits like this will help them become self-aware and will bring them out. If there are problems, they will come, they will approach the doctor, and they will talk about their problems to the doctor. So I think this is very, very important. This is a good step forward, and I think congratulations. And I'm really happy. Being in this field, caring for women, I think it's a very positive step forward. HPV test, and doing it at home, I think that's the best thing that has happened. I think that is the best thing that has happened, because awareness. But first, Mayur, we'll have to spread awareness. Because I was at a police camp, and I said, how many of you all have done pap smear? Two people raised their hands. Then I said, do you know what a pap smear is? Nobody raised their hands. So first thing, I urge all of y'all are the press, the awareness has to spread. I think you need to spread the awareness. We are doing our best. We feel, all of us, we talk about it. The awareness needs to spread, and then this will really help. The HPV test kit is phenomenal, because if we can test the HPV and prevent, the worst killer today in young women is HPV. And it's not only women, it's also for the men, because it causes STDs in men, and that can go to the woman. So HPV is another thing which is really something which can be picked up, and there is a vaccine. So if you're negative and you take the vaccine, that can really help. So there are so many preventive things. I think this particular press conference, what I feel of the products is not only, it is preventive. And today the world is moving towards prevention. We don't want to be symptomatic and then be treated. So there are a lot of things here, the genetic tests, the HPV test, so much of it, half of it is preventive. And I think that is what we're looking at, the sperm freezing, the egg freezing. Egg freezing is women empowerment. I personally feel it's women empowerment. I've been one of the pioneers in the field, and I've been promoting it a lot, and I have a lot of women who have frozen their eggs. I've got nearly 7,000 plus eggs frozen of girls for reasons that they've not found the right person, or they've been educating themselves, they've not had the opportunity. So I think it's prevention also. So we need to talk about it because today it's important in the world. So thank you very much, and I think I'm really happy to be here and would be really happy to answer all your questions. It would be really be great to have a conversation. And I think the duty that you have is awareness, and the duty that we have is to give you the information. Thank you.